Access to quality and affordable healthcare has for years been mooted by successive governments in the country, but hardly ever translated beyond the realms of political rhetoric at best, with issues such as inaccurate data about the actual number of Nigerians requiring certain healthcare services. Planning for such has been an immense challenge, but that is about to change. This is a 20-member National Healthcare Digitization Committee being inaugurated by Ali Pate, Nigeria's Coordinating Minister of Health and Social Welfare. This is a huge step towards repositioning the country's health sector, particularly from the standpoint of having reliable and accurate data to work with.
As the Federal Ministry of Health and Social Welfare seeks to address the numerous health issues, digital solutions and data have been identified as powerful accelerators relevant for the transformation of health systems and the delivery of universal health coverage to the population we serve.
How can digital transformation help us reduce cost of care by the providers at different levels, or even for the purchasers like NHI or primary healthcare or hospitals, and using the platform to improve the work life of the health workers themselves, the providers who are using the tools that will be the outcome ultimately of this work to improve their own work-life experience.
The National Health Digitization Committee is to be headed by the Minister of State for Health and Social Welfare, Dr. Tunji Alausa.
Your healthcare information should be private to you. Right now, we don't have regulation. You heard me said earlier on, the entire data architecture will involve several aspects: data governance, data security, data repository, data services where the electronic medical records fall in, and standard for technology company for setting up data services and then regulating these data services. So we would have, at the end of it all, we will have a regulatory environment that will monitor the standard, the technology platform we use, so that they can begin to have high level, internationally acceptable level of data privacy.
I hope to bring my years of experience and understanding with respect to how the startup ecosystem can be truly a part of the impact that we want to make in terms of quality of life. So in terms of what we need, the access to infrastructure and data that we need to be able to do what we need to do, access to identity, government collaboration in a way that is not adversarial.
The private sector will drive this new data collection initiative in the healthcare sector, whereas the country will own the data that will serve as a tool for policymakers towards effective planning for the country's healthcare. Godfrey Eshamoge, Arise News.